Welcome. My name is John, and in this brief video, I'm going to walk you through our stool test at Progressive Medical Center. With this test's results, we will be able to efficiently analyze and correct your gut health. It may not seem like it, but 70 to 80% of your immune system is located in your gut. A compromised gut environment can create dramatic effects on your health. This test, though not the most pleasant, is the most important step you can take towards total body health. That said, congratulations on taking strides towards bettering your health. Now that you've taken this step, it is critical to follow these instructions carefully to get the most accurate and useful results. While your diet does not need to adjust before your test begins, you may still need to prepare for up to 2 weeks depending on your medicine intake. Before we discuss this next section, we recommend pausing the video and taking a picture of this list. 2 weeks prior to your first test, discontinue the following: antibiotics, antiparasitics, antifungals, probiotic supplements, proton pump inhibitors, and bismuth. You will also need to discontinue consuming fermented foods such as kimchi and sauerkraut, and probiotic-type foods and drinks such as yogurt, kefir, and kombucha. 2 days before your first test, discontinue the following: NSAIDs such as aspirin and ibuprofen, digestive enzymes, activated charcoal, betaine HCI, antacids, bentonite clay, and laxatives, particularly mineral oil, castor oil, and glycerin enemas or suppositories. If one experiences difficulty having bowel movements without the use of laxatives, please use the following approved bowel moving agents: oral fleet, psyllium husks, magnesium citrate, and prune juice. Finally, wait to take your test for at least 4 weeks after a colonoscopy or barium enema, and do not proceed with the test if you're experiencing menstruation or active bleeding from hemorrhoids. Before you begin your test, confirm you have the following within your kit box: 1 requisition form, 1 FedEx clinical pack with a prepaid return label, 3 cardboard stool collection trays, 1 ice pack to be placed immediately into the freezer, and 4 specimen bags. Verify that each of the 4 specimen bags contain absorbent material, a glove, and at least 1 vial. Note that the specimen bag containing a white-capped vial will not contain a glove. The specimen bag labeled Day 1 and Day 2 should each contain 1 vial with a black cap. The Day 3 bag should contain 2 vials, 1 with a black cap and 1 with a yellow cap. Finally, the separate Day 3 specimen bag should contain 1 vial with a white top. Please save your blue test kit box for shipping your specimen back to the lab. For your safety, please note that the black and yellow capped vials contain a liquid preservative. If you notice leakage or the liquid levels falling below the middle of the vial, call Progressive Medical Center customer service for assistance, 770-676-6000. Be extremely careful not to make contact with the liquid preservative. If it makes contact with your skin, wash the area thoroughly with soap and water. If the liquid makes contact with your eyes, flush your eyes with water for 15 minutes. If you ingest the liquid, please contact a physician. Finally, remember to wear the provided gloves during every step of specimen collection to stay clean and healthy. This test will include gathering stool specimens over a 3-day period. Each day will be unique, so please pay close attention to the instructions for each day. Now that you have waited the appropriate time after stopping medications and confirmed you have a complete kit box, you are ready to begin your first day of testing. It is important that you pay close attention to each of the collection day's instructions, as they are all different and failure to follow their unique steps could result in inaccurate results or rejected specimens. Prior to collecting your specimen, write your name, date of birth, and the collection date on the side of the vial, and check off the consistency of the stool. First block is normal, second block is constipation, third block is for mushy stool, and the fourth block is for diarrhea. Before we move forward with the rest of the instructions, we want to clear the elephant in the room. You will have to handle your poop, and we get it. That stinks. However, the entire reason you're doing this test is to heal your body, so you might as well get comfortable with it. With that being said, you will have to poop in the collection container provided. Please put on a glove on the hand that is holding the collection container and collect your specimen. Be careful not to contaminate the specimen with urine or water from the toilet. Then unscrew the black cap off the day 1 vial and use the attached spoon to transport the stool specimen into the vial. Be sure to take multiple stool samples from different areas of the entire stool in the collection container. Continue this process until the vial is up to the fill line. Do not overfill the container. Then securely screw on the top and shake the vial vigorously for 30 seconds to mix the stool with the preservative in the vial. Please place your vial back inside the day 1 collection bag and place it inside the refrigerator. You are complete with the day 1 collection. The great news is that collection day 2 is identical to the collection on day 1. Please revisit the tutorial for day 1 instructions, but be sure to use the day 2 bag. While day 1 and 2 are identical in procedure, it is important to pay close attention to the day 3 instructions. The biggest difference for this collection day is the fact that you will need to fill 3 separate vials with the same stool. Pay close attention though. These vials have different requirements. Inside the first day 3 bag, you will find 2 vials, one with a black cap and one with a yellow cap. For these vials, repeat the collection process just as you did with the previous 2 collection days. Label, collect, transfer, and shake, then place into the refrigerator. For the white-capped vial in the separate day 3 bag, begin the test the same way by collecting the specimen and transferring it into the vial. However, you do not need to shake this vial because it does not contain the preservative. Then, place the white-capped vial inside the day 3 collection bag and the ice pack into the sleeve of the collection bag and freeze for a minimum of 6 hours until shipped. After you freeze the white-capped vial for 6 hours, you are ready to ship. Please make sure you ship all 3 collection day specimens, the requisition form, and make sure to include the ice pack with the white-capped vial in the shipment. Refrigerated specimens go on the bottom. Frozen specimens with the ice pack go on the top. It is vital that you include the requisition form, otherwise the test cannot be processed and you will have to redo the test. We both know you don't want that. Fill out every page, including the collection date, date of birth, sex, and signed date the requisition form to avoid delays, test cancellations, or recollection. The requisition form is only 1 page. Please fill out the highlighted areas only. Do not fill out the credit card information section, as your kit is already paid for. For Medicare patients, please include the ABN form you filled out at the office with your financial counselor and include the copies of your Medicare card and personal identification that a financial counselor provided with the requisition form. The requisition form needs to go on the outside sleeve of the day 1 specimen bag. If this isn't done, condensation will wet the form and render it unreadable and cause the test to be canceled. Place the provided prepaid label onto the bag in the designated location. Record the tracking number printed on the label if you want to track this delivery. Now place the specimen bags and requisition form inside the cardboard box. Next, insert the cardboard box into the FedEx clinical pack provided and ship within 24 to 48 hours on Monday through Friday. If you would like to schedule a pickup, you may call FedEx toll-free at 1-800-GO-FedEx to schedule a pickup or take to a local FedEx location with indoor drop-off capabilities. Do not leave the box in a FedEx outside drop box. Congratulations on completing your test. I know this may feel overwhelming, but this stool test is the most important test that we offer. As stated earlier, a compromised gut environment can have a dramatic effect on your health, so knowing your gut health is the most important foundation for bettering your well-being. We only ask that you follow these steps carefully so that you find the most accurate results without having to repeat any collection days. If you are feeling discouraged or unsure, you are welcome to reach out to us at Progressive Medical Center, and we will be happy to discuss the test with you. With our collective efforts, we can change your gut and overall health for the better. Thank you for watching.